call junk science. So we really need to think about that. We're 10 minutes in already. Wow. But we need to think about that. But the bottom line is I'm going to not harp too much on healthcare today because I want to talk to you about some other things. But what I will say is I do not have the website with me today. But it is a website that you should be able to remember. I'm going to give it to you. And there are a lot of other websites you'll be getting today. So get an ink pen and get a paper. If you're taping the show for future use, that's a great thing. Maybe you can put it on VCR if you still have one, or if you have a DVD burner, or if you see it online in a couple of days. But the first website I'm going to give you is www.whitehouse.gov. It might be thewhitehouse.gov, but check it on the Google. But if you go to the White House, they've put up a special link to what this proposed health care reform really is and what it is not. And we went into that a little bit on critical condition 1 and eventually critical condition 2, which I'm going to be submitting later this month, hopefully. But we went into that. But the thing is, the bottom line is, our lives are at risk, okay? It really comes down to that. My life and everybody in this room, and quite frankly, most Americans need to make sure we have health care for everybody. You may actually have great health care. You may have had it all your life. You may be wealthy. And you might think, well, I don't want to change. I don't want to be forced to change my insurance carrier, which is not going to happen, first of all. But here's the thing. What if you're wealthy today, but you make bad investments, and in the future, you need access to health care that's not exorbitant, not high cost? What happens? Do you think that just because you're in great condition today, that you're going to be in great condition your entire life? I hope you are. But the odds say that you're probably going to get some kind of a disease. It might be heart disease. It might be Alzheimer's. It might be Parkinson's. It might be cancer. But it could be something. And even people that are wealthy, many of them have lost hundreds of thousands of dollars when they got seriously ill, or millions of dollars, or went bankrupt. Now, these are not statistics I'm throwing out there. These are facts. These are, things that I'm throwing out. These are actually statistics is what I'm saying. So this whole business about health care is bad for America. It's socialized medicine and all that stuff. I'm going to tell you something. I'm going to tell it like El Torcaso. The name of the show is Let's Fight, and it's Let's Fight for a reason. Let's fight for honesty in Washington. Let's fight for honesty in the city of Pittsburgh. Let's fight for honesty in Allegheny County. Let's fight for honesty in the state of Pennsylvania. And we can begin with honesty on the federal level when it comes to health care. What this health care plan would do is it would end pre-existing conditions discrimination. And by the way, you may be thinking, well, I don't have any pre-existing conditions. I never had cancer. I never had heart disease. I never had, can you name some other diseases?
Lupus.
Lupus or something like that. I never had any of that stuff. So you might be thinking, oh, the healthcare insurance company is not going to discriminate against me. I'm a non-smoker. I'm a 34-year-old woman, non-smoker. I'm healthy. Don't have any breast cancer or any predisposition, anything right now. You might be thinking you're basically all right. But here's a little secret that not everybody knows. If your family has a history of it, or let's say maybe a distant relative had cancer, or what have you, a lot of times companies will try to discriminate against you, use that to either raise your insurance or not provide you any insurance. So this reform includes no discrimination for pre-existing conditions, and also ultimately it would make 97% of Americans either be covered or be able to be covered. It would also, for the poorest Americans, which everybody in this room can be counted on, each of us are over 150% below the federal poverty line. In fact, to give you an idea of what that means is there are poor people and there are below poverty or below poor. In fact, it may sound funny, but if I got to be poor, I would feel rich because I am over 550% below the poverty line. Not 150, not 250, all the way down to 500. So how does that have relevance? Well, it has relevance with the health care because sometimes and many times you may have state provided. And I was wrong, and I have to correct myself. In the video, I said state issued or whatever. It's not run by the state, but it's state provided by private agencies that they can contract it with. For example, we have UPMC for You. I'm not advertising, I'm just telling you what they are. We have UPMC for You. We have Gateway Health Plan. And what's the last one? Do you know, Chris?
I believe it's Unison, but it's
Unison.
But it's UPMC for life, not for you.
Well, UPMC for life. I'm sorry, I got my U and my life wrong. And then it's Unison. But you may have these coverages and you think, okay, well, why are they complaining? Why do they want this health care law? Well, first of all, a lot of things are not covered under these plans, and including dental. But more importantly, if you're on these plans, there's a lot of doctors who won't accept it. There's a lot of dentists that won't accept it. They hear UPMC for You, Unison, or Gateway, and they're like, please get as far away from me as you can. Now, that doesn't sound good about these plans, does it? And I'm not trying to vilify them or say anything bad about them, but all I can say is if doctors and dentists won't accept them in a lot of cases, we have to ask why. There has to be a reason. Is it because they're not getting paid? Or is it something else? But that's beside the point. Say you do have these plans, and let's say you have a good doctor and you're able to find a good dentist. Why then would a Al Torcaso or a Kathy Payer or a Annette Mendel or a Nancy Way or a Chris Weiss still want this universal health care, as it's been called? Well, because if you are on a broken budget, otherwise known as a fixed budget, it's a broken one. It's not fixed, it's broken. But if you're on a broken budget, I call it as I see it, okay? And I'm not trying to be rude or ignorant, but if you're on a broken budget and you're poor and you need to pay a copay of even as little as $2 for your medicine, well, there are people in this state who are living in like personal care homes and stuff. They get, I think, $85 a month. So they may not have the money for their medicine. And even if you do have it, let's say you go to the doctor, you could end up like Kathy Payer. She went to the doctor, she had 2 coverage plans, yet they wanted her and still want her to pay $143 of money that she doesn't have. And because she doesn't have it, if she doesn't pay it by a certain time or make an agreement, what will they do? All of you out there know what will happen if she can't pay it. They'll send her to a collection agency. They'll try to ruin her credit. And what happens if we have bad credit, people? We have a hard time getting a loan and what have you. The bottom line is health care or the lack of health care or the lack of sufficient coverage and reasonable copays, the lack of that affects our lives. So that's why